When they said the end justifies the means, I think they were referring to our today's topic. Nonetheless, going number 2 has never been a pleasant topic to discuss, especially on a dinner table. However, the fact will still remain that we all do it. For some it's a necessary inconvenience, while others see it as a pleasurable and satisfying part of the digestive process. In the end, no pun intended, it is simply a part of a functioning body. Before we dive into today's topic, we might want to ask ourselves, where does poop come from? When you eat, your digestive system breaks down food into smaller molecules that are absorbed into the bloodstream, providing your body with nutrients. The undigested food, along with fluids and older cells from the lining of your gastrointestinal tract, are then passed into the colon, popularly known as the large intestine. The colon then tries as much as possible to absorb as much water and salt from the undigested food remnants, turning the liquid waste into solid waste, the stool. The colon then pushes the stool to the rectum for storage through muscular contractions called peristalsis. The rectum will store the stool until the body is ready to eliminate it. When full, the nerve cells signal the brain, which sends back signal to the sphincter muscle in the anus to relax, allowing the stool to come out of the body. A healthy poop can be as varied and unique as the individuals who make it. However, there are a few general guidelines to follow if you want to assess your poo artistry for optimal health. Scientists have even gone a notch higher and come up with a poop rating system known as the Bristol Stool Chart for the same. Type 1 and 2 embodies constipation. With type 1, you basically excrete small, separate hard lumps like a goat. Hold on, I'm not talking of the likes of Lionel Messi, Mike Tyson and Tiger Woods. Focus. The worst bit is that the stool is so hard to pass. What happens is that the stool moves too slowly through the digestive system, losing too much water through absorption and becoming dry. With type 2, the stool looks like a bunch of grapes and hard to pass. The causes of type 1 and 2 include not drinking enough water, not eating enough fiber, and holding it for too long. Now, if your stool lies around type 3 and 4, we can basically say you have a proper digestive system, you are hydrated and eat enough fiber. Type 3 exhibits a sausage-shaped stool with cracks on the surface. It looks like a corn of cob. For type 4, it's sausage-shaped but smooth and soft like a snake. In the case of type 5, 6 and 7, the stool is moving too fast in your digestive system, often due to infections, food intolerance, or ingestion of spicy foods. Basically, this category encompasses diarrhea. The type 5 stool looks like chicken nuggets. It's masses of soft blobs with clear-cut edges that are passed easily. Type 6 stool almost resembles porridge with fluffy pieces and ragged edges. It's quite a musky stool. For type 7, the stool is too watery with no solid pieces, just like gravy. The Bristol Stool Chart categorizes poop based on their shape. However, that's not enough. Blending it up with other parameters such as color, smell and length of time can render your analysis as an effective thesis that can be used to draw a conclusion. When it comes to color, brown is the gold standard, the sign of proper digestion. Even emoji developers knew this fact. It is a result of the combination of stomach bile and bilirubin, which is a pigment compound formed from the breakdown of red blood cells in the body. Green stool could be a sign of eating too much leafy green. It could also be an indication of eating food with artificial coloring. The color signifies that the food is moving too fast through the intestines. Yellow and greasy stool is a sign of poor fat digestion and absorption, possibly linked with the celiac disease or other digestive disorders. Black stool may be a warning sign of internal bleeding in the upper gastrointestinal tract. It may seem that red may be the likely color for this concern. However, since the stool has taken a while to travel down, it's older and darker. Black stool may also be brought about by iron supplements or eating too much black licorice or bismuth medications such as Pepto-Bismol. Bright red stool could be a sign of eating beets or red-colored foods such as cranberries, red gelatin, and tomato sauce. It may as well signal bleeding in the lower intestine or hemorrhoids. Having a stool that is pale, white or clay, almost like a chalky light shade, might mean that you are lacking bile, a digestive fluid that comes from the liver and gallbladder. So, when you are having a white stool, it could mean that your duct is blocked. Pale poop could also be a side effect of certain medications, like anti-diarrhea medicines. Either way, if symptoms persist, you should consult with a healthcare expert. When it comes to density, a sinking poop is a good sign and means you have a healthy balance of fiber and nutrients. However, when you see your poop bobbling like a toy sailboat in a bathtub, it could indicate poor fat absorption, linked to conditions such as pancreatitis or celiac disease. With regards to time, a healthy poop should be easy to pass and take only a minute or so to push. Taking too much time pushing could be a sign of constipation. On the flip side, pushing stool within seconds could signal diarrhea. As quick as we are to write it off, our poop can provide a wealth of knowledge about our health and ourselves. So next time you pop a squat, take note of what is going on. The toilet bowl is a window into your health and you. Thank you for your time. I wish this video improves your life and the people around you. See you next time.